Hello, and welcome to Health and Fitness Redefined. I am your host, Anthony Amen, and welcome to the first episode of our three-part series of small business survival. I am super excited to have four wonderful people sitting next to me. This episode is going to be based on small business and the effects of COVID and how it's pretty much implementing everyone's bottom line and what's worse. That's what we're going to decide, the cure or the disease. So first up, we're going to go do a round robin. Kevin, welcome to the show. Give a little introduction about yourself.
Kevin Godfrey with Trusted Safe. And basically what I do is I test, implement protocols, procedures for COVID, bacteria, germs, and whatnot. And I'm just here helping out the industries. Various industries, actually.
Everywhere.
Every industry.
And
specifically this industry.
Charlie, you've been on the show before, so tell us a little bit. Remind us where you're from, what you're doing. I know things have changed in the last 2 months since the last one we did, so
a little bit.
Go for it.
My name is Charles Casara. I own two fitness facilities, one in Suffolk County and one in Nassau County. And I'm also the president of the New York Fitness Coalition, which is partnered with Kevin in trying to implement policies to advocate for our industry as well as keeping us open.
Thank you. And then we got Rob. Rob, a lot of people know very well that are watching this right now, I'm sure.
How you doing, my friend?
But Rob, tell us a little bit about why you're on here, what we're talking about.
Sure.
And what you do.
Okay. I am Rob Taramina. I'm a small business owner. I own a couple different ventures from marketing agencies, law firms, and some real estate stuff. And I have a feeling I'm going to be ganged up on today as a landlord, but we'll see. I'll try to hold my own. We got some smart people here, and so far I'm definitely not the smartest out of your little round robin. I feel like we've got like this crazy brilliant genius over here. So
Kevin's gonna say words that none of us are gonna understand.
Yeah.
No.
Hold on, I'm gonna have Google ready.
Oh shit! All right.
And then Eric, first time we're meeting, so Tell us everyone a little bit about yourself, what you do.
All right. Well, first off, thank you for having me. My name's Eric, and I have an acai bowl store called Soul Bowl. It's a franchise, and it's located in Wantua, and that's about it. I'm franchisee of the year, so I have a good name with the brand, and I'm happy to be here.
Happy to have you, man.
Yeah, thanks, man.
First, we're just going to get into some updated numbers posted on the CDC website as of yesterday. Currently in the United States, there are 7.75 million cases, 214,000 deaths, with the mortality rate being 2.76 death rate. In New York specifically, because that's where everyone's from, and that's where we're going to talk about, is New York. We are at 508,000 cases and 33,377 deaths. A little bit interesting. Everyone obviously knows and watches the tickers on all social media websites. But first, I just want to talk about specifically how has COVID and New York specifically affected you and your businesses. So Charlie, I'm going to start with you on that one. Tell us a little bit from the fitness industry standpoint how these cases and New York State has affected gyms.
Well, I think the cases, they're two separate things. So COVID itself affected the industry by being mandated shut. But it was where we were placed in the reopening phase that really just did us in. So the fitness industry wasn't considered professional or essential, and there's lots of reasons why we're not. But here in New York, when the governor made up his list of the opening, and for anybody who's not sure about that, it was the governor who decided the opening protocols and who opens where. That was him and his team, so it was not across the country. We were put in phase 4 in that recreation spot. So that pushed us all the way until the end. And then when we found out at the end, we weren't even allowed to open at that point in time because we were labeled, dangerous and a whole bunch of other stuff that we've spoken about. So, I think that that's really what did it. It was being put in that phase 4, then not being allowed to open for another, I believe it was 8 weeks after that. The industry just can't survive on that. And now here we are at 33%. No way we're going to survive on that. And there's no hope of getting to 75, 80, 90, or 100. Plus, we also have the strongest restrictions. So we're 6 feet apart at 33% with masks. Well, it doesn't really matter. I could be at 50 and 75% because I still can't get that because I have to be 6 feet apart. So there is no really moving forward here until these mandates and executive orders get shut down. So for us, I can tell everybody who is listening, your small businesses, whether they be a restaurant or it's a gym, you're going to see a 60% close rate by December throughout the state. Now, you know, for some, you might be sitting at home being like, well, that's what we have to do to save people. That's what we have to do. But I think at this point, we now need to think about the lives of everybody that's being affected by the shutdowns, the mandates, whether it be a suicide rate, whether it be alcoholism, whether it be spousal abuse, depression, losing your net worth. Right? Yeah. So that's really what's happening here. We're losing our net worth. So college funds are being depleted. You're not going to be able to send your kids to college. Your mortgages are well in the rears, and you're never going to make that up. They don't go away. A lot of us have personal guarantees on our rent, and that's not going to go away. So the effect of COVID for us really wasn't about the first 2 months because I think we all did what we had to do when we were learning about this disease. But since we've flattened the curve, which was the real reason to be shut down, flattening the curve, it had nothing to do with an overall death rate or it had to do with flattening the curve so that it didn't overwhelm the hospitals. I think if you take it from that point to where we are now with the current structure, we're just looking at a 60% rate for an industry that is an $80 billion industry. So it's absolute devastation is what it is.
We're going to get into the financial numbers a little bit more, but first I want to throw it right over to Eric. Yes. I want you to talk to us. Obviously, we got the gym side. Talk to us from about your perspective, because owning a Sobel, et cetera.
We definitely took a hit when everything came down. And, you know, following protocol and following all the numbers and everything like that, I personally decided to close my store, even though I was essential. But it was a decision that I made due to drop in business, lack of employees that wanted to work, just, you know, everything just kind of going down the hill. So I decided to close, you know, trying to do the right thing. And unfortunately, I got kicked in the nuts, like I said before. And while I was closed, the car came through the front of my glass and had to shut us down for an extra 4 weeks. But, you know, we recovered. We're doing okay now. You know,
I couldn't imagine. Just thank God you weren't working.
Yeah. No, it's a good thing no one was in the store. Nobody got hurt. But maybe
a little minor blessing on that one for you.
Just a little bit.
Just like a 5% right there.
It probably couldn't happen at a better time if it was going to happen. But yeah, numbers decreased about 65%. I was working twice as hard. I didn't feel like catching this disease. I would have to close anyway if I did. So I shut it down early. You know.
Thank you for that insight.
Yeah.
Rob, I'm going to throw this next little stat at you, and I want you to talk about it a little bit from a landlord's perspective. Mm-hmm. So financially, small businesses employ about 60 million people. Mm-hmm. That's what we're currently at in the States. They are saying that 4 million small businesses have already shut, putting that number about 13%. Yeah. And they're expecting that, especially in the state of New York, to shoot up to 60%. This is something people don't talk about. Mm-hmm. How does it affect landlords? Because I don't believe most people understand that landlords can be small business owners.
So no, they are small business owners.
They are.
Yeah, so it's not that they can. You know.
So talk to us a little bit about that from your perspective and how this is going to affect you over in the long run.
Sure. I mean, the easiest way to explain it is liken it to the example you guys are giving. Everyone is a small business here, right? And we're talking about the challenges that we faced and, you know, how are we going to overcome these challenges? And anyone who is in business, either as an investment or as their full-time gig, all of this stuff is registered in an LLC. My commercial buildings are registered in an LLC. They are an independent business. And without necessary income, those businesses are going to be operating at a loss. Now, if a business operated at a loss, you would have to make what decisions? You have to make cuts. Right? And if you have to make enough cuts and you can't weather the storm, you're not liquid enough, what happens to that business? You got to fold. You got to file for bankruptcy and all these things. Same thing happens with real estate. And I really think that we're at a critical point in the real estate world that if all of these people who own whether it be big commercial buildings like big office buildings or storefronts, if they're not able to pay the bills, right? They've got mortgages as well, and if they can't pay those bills, those buildings are going to go into foreclosure, or they're going to be sold, and they're going to end up vacant, right? So the small businesses that don't own the building, where are they now going to operate? If that business now is owned by the bank, it's going to be governed completely differently.
So
And-
if I'm a small business owner and I
Yeah.
have my gym in your shopping center,
Yeah.
and you file bankruptcy and close, I have to close my doors.
It's possible, right? I'm not saying that's an absolute truth.
Yeah.
But in many situations that where the landlord is unable to pay his own bills, like another business, you have a small business who's just renting has an easier decision actually, because they can close their business and walk away from their lease at that point, right? Because they file for bankruptcy and everything's done.
Yeah.
But a person who owns the building, there's a greater financial responsibility there, and there's greater financial risk. And like for me, I'm not saying everyone, but for me, like I'm not in commercial real estate to be charitable. I'm being honest about it. I have.
is?
Well, maybe some people are, and that's fine. But I'm not in commercial real estate to be charitable. I can't afford. I've got a family. I've got young kids. I got triplets, my friends. Listen, I got 3 10-year-olds. It takes a lot, right? So, I have to look at it like a business, and I've got to manage my financials like a business. And if a tenant is unable to pay, as a landlord, I've got to make a decision. Now, there also comes a time where there are extreme circumstances, pandemic. That requires compromise. Because as a landlord, everyone has different strategies, right? But for me, I don't want vacancy. So I would rather help out during a pandemic to secure that potential tenant for the long term, rather than being a hard ass and him having just leave me anyway. And now, not only am I out a tenant now and in the future, but because I'm in during a pandemic, I'm not getting anyone else coming in right now. So I think landlords are put in a really hard position where they're forced to have to compromise right now, and they've got to be smart about it. And listen, there's one thing: you be empathetic. Absolutely, I believe in empathy, but sometimes empathy forces you to compromise, and you end up losing money, right? So you got to be careful with this stuff. And so I feel for the landlord. Now, there's a lot of jerks out there. There's a lot of jerks who are landlords. There's a lot of jerks who are small business owners. There are a lot of jerks that are neither, right? There are just a lot of jerks out there. But I think that one thing that we have learned during this pandemic is that we cannot survive by ourselves. We can't. So we have to rely on community, and we have to rely on extending help where we can. Anthony, we've talked a lot off camera about this stuff.
Oh yeah.
And I think that surviving, I hate the phrase, I just want to survive. I do want to thrive, right? But I feel like I'm going to be honest. I hate admitting this, but now it's a matter of survival. Now my focus is not on, I want to thrive during the pandemic, because I don't know that is an opportunity for a lot of people to thrive right now. But I do want to survive through it so that ultimately I can be better off later on, So I feel for small businesses that don't have any income and now they've got their rent. I encourage landlords, where you can, work something out. There's lots of creative solutions to being a landlord. And if you're a good business owner, you've got some liquidity, and that's why, like for me, and I want to kick this back to you guys, but like for me, even with my businesses, is I always want to remain somewhat liquid. Listen, I never predicted a pandemic, right? But you want to remain liquid this way. In the event of a challenge, you can weather the storm, right? So I didn't let anyone go. I didn't fire anyone. I didn't furlough anyone. And I think that's important. But I've got to apply those same principles now to my tenants as well, right? So I can't fire them and kick them out. So I think landlords do have to compromise, and it sucks right now. And I think now more than ever, I think the conversation is different. Like 5 months ago when we were talking about this, I think landlords could have been a little bit more stubborn. Now they don't have a choice. I think landlords have to compromise.
Yeah, they have to compromise, and I mean that's the good way to think about it. But I think you have a couple of other issues on it as well, because at some point in time the landlords have to be truthful with the tenants, and I think it's not.
That's a good point.
It's not always about doing the right thing. It's you're in the same boat we are. You just got a different boat. Okay? So
Great
it's not where, we need to help out. No, you're screwed just like we are. So, I'm going to sit across from my landlord, and my landlords have worked with us. So I'm not complaining here at all. They've done the right thing. But it was just a funny conversation because I looked at them, they looked at me, I went, And that was it. There's not a lot to do here, whether it be paying carrying costs. But where I mean truthful part is a lot of landlords, if this is their business and their business is commercial real estate, they were either able to rework most of their notes on the buildings, but they're not going to tell the tenant that. Now, some banks won't do it, depending on the structure, whether it was a government-backed loan or whatever. So sometimes you couldn't get away with that. Yeah. They also filed for PPP, and they got a lot of money off of it. Now, in theory, that money should have went towards your tenant because you were able to cover your expenses. Yep. If you are able to cover your expenses free of a forgivable note, you should have pushed that forward. Yeah. But you're never going to admit that. Yeah. Okay, so if you ask the question, they should be able to tell you. And if that's the case, well, then my 3 or 6 months should be let go. The other thing is, as far as liquidity goes, and that's always brought up in conversations that we have, no one, I don't care who you are, the average income across the country was able to survive for 2 weeks. Now, PPP was initially meant for 2 months. But when you had a majority of the small business industry not even get it, right? Now we're going on month 7, and we're still at 33%, just our industry. Now, other industries are at 50% or 25%. We have 100% of the bills at that percentage rate. So it does come to a point where it's like, we need to work together. Where I think it really puts, pressure on landlords now is the personal guarantee law that was pushed until next year. That's a joke. Okay, so that means if I think it's pushed almost till May now. Yeah. If I want to turn around in April and walk away from this business and say, see you later, you can't come after me personally. So now you're lost all those months. Yeah. So I think that's something that has to be looked at. Yeah. And then, there's just nothing for the landlord. You can't throw me out now or even begin eviction until the end of this month. Yeah. And that's going to get pushed again. Yeah. And we happen to know it's going to take 18 months to 24 months for you to get me out.
Well, I want to talk about something
New York,
New
York.
Yeah. Let's bring this back. I want to ask a question, then I want to go based off of it. And I'm actually going to turn this question over to this guy right here sitting next to me on my left.
Me? What do I have to do with any of this?
Right here. This is where you're coming in, Kevin. You go around, you're testing all these businesses, making sure they're safe, right?
Yeah.
So my question, because you've got in contact with people across all of industries.
Yep.
What have you seen from the public trusting businesses? And there's a question Rob prompted pre-show, where if they've had a confirmed case and that person has showed up, are people returning after knowing that, even if it's not from that industry? So let's say I contracted it outside, I showed up at your place of business. Now they know they're contact tracing, I was at your place. Are people showing up or not? Do you see that at all happening?
So really where it's at right now, I'm getting the cue to lean closer. So, fourth wall here, So, basically where we're at right now is, so with all of the different industries, there's just like so many different guidelines per different industries, right? So like certain industries have to declare it immediately. Some have to call each person, like everyone, right? So like salons or dentists, for example, like, right? Like, so if someone comes in and gets a confirmed case, the dentist has to literally go down and say, hey, you were here at 213 and da-da-da-da-da. Like, fitness industry does not have to do that. Restaurants don't have to do that, but like certain industries have to and some don't. So where it comes down is, do you do that? How did they? All right, I'm actually going to take a step back because it's actually a very complicated question. It's actually a very complicated question. So it really comes down to, in the simplest terms, is how did they find out about it? Right, and that's actually the simplest answer. Did they find out from a friend of a friend? Did they find out from a mom group on Facebook? Did they find out from Newsday? Or did they find out from you, the business owner? Right? Did they call up and say, hey, listen, I just want to let you know that we did have a confirmed case 3 days ago. I just want to let you know that you really didn't come into contact with it. There was no danger on your end. We did bring in a deep cleaning company. We did disinfect. We did A, B, and C. You're completely safe. But just for your protection, we wanted to let you know. That's a way to handle it. Or if they found out from a mom group on Facebook and they call you and say, why didn't you call me? Why didn't you let me? That person is never coming into your business again. Right. So that's the perception. So it's really how you manage that confirmed or suspected case. And then on that end, on the front-facing end. On the back end, it's how you handle it on a disinfecting, cleaning end, and the actual how to handle it per guidelines.
You're actually making. I'm sorry to interject here,
No,
but you're
it's
making
good.
a good point because there's two perspectives here. Yeah, I said in the beginning you're the smartest guy here, right? So you make mention of two really important distinctions. Number one is the mandated protocol from the business, and then the second decision is what should the business owner do actually now thinking about your business to bring people back. Because perceptually that it is different. So I think that's important. And, it's not just about doing just the bare minimum, but always think like I'm in the marketing guy, right? So think about the end user. We're going to think about our end user and then work backwards.
Yeah.
And I think that's a good way of maybe making decisions here. I mean, to help you sort of answer the question a little bit,
Yeah.
because sometimes maybe, and Anthony, I know you're really upset about this, and for the people in the fitness world is upset. You guys have some pretty heavy restrictions on you guys, right? So that really stinks. But maybe, perceptually think about just that end user, and not for the business, because you guys got to do everything. I feel bad. Like, thank God I don't own a business in the fitness world, right? So, but for everyone else who maybe the regulations are not as severe, I don't know that your bare minimum might be enough for your community to come back.
Right.
And I think thinking of your end user. Now, we can get into debate about whether or not COVID actually is more lethal than it really is, or really like a terrible.
I got the numbers.
Right? We could talk. That's fine, right? And that's a different discussion.
Yeah.
But as it relates to perception, that's irrelevant.
Right.
So from a business owner, you got to think, all right, perceptually, regardless of state and federal regulations, perceptually, what do I need to do to ensure safety in the mindset of my consumer, both today and tomorrow? And that's a really good point. There's two decisions that a business owner have to make.
And I want to actually turn that back over to you, Eric. You've been open the longest.
Yeah.
I think that's safe to say, out of the gyms and.
We about 3 years and 4
Boo.
months.
Boo.
No, I meant since COVID.
Oh,
Since
since COVID.
COVID.
Oh,
Yeah,
yeah.
since COVID.
Yeah, we've been going.
Have you seen people being afraid of showing up? I want you to talk about it both from a consumer side and a staff side. Was it
Okay.
hard to get staff members to come back during phase 2, 3, 4? Was it?
Staff
that
members.
process?
So we're always kind of going through staff. That's just the nature of the business. But yeah, at first it was we had to convince them a little bit to come back, but also because we were closed longer than what I predicted, they were kind of eager to come back, especially the kids. So that was fine. As far as customers, we opened up to Uber Eats and DoorDash and online ordering, so curbside. So we tried to accommodate customers as much as we could to make them feel safe. Also, we had to put up all the shields.
Yeah.
Everyone, masks, gloves. We always wore gloves, but mask and.
I hope you're wearing gloves.
Yeah, we always wore gloves. But also the cost of everything. Gloves have tripled. So we gotta supply masks. So that adds hundreds of dollars a week.
Yeah.
So take that into account too.
And do you or do you know someone personally that's had someone sick in a restaurant or anything like that where it's really affected them in their bottom line?
No, so luckily we haven't had any cases.
And do you know anyone personally or no?
Personally, yes. Actually, you know what? I'm sorry. I'll bring that back.
Okay.
I did have a girl. She did get the corona, but she's like, it was fine. She wasn't really bothered by it. It wasn't really a big deal.
And you didn't have any issues with any staff members
No.
worrying about it?
No. I mean, some kids took off, and I said, just get tested, give me the results, and you're good. But she did the right thing. She stayed home 2 weeks. She got tested. She's like, I'm good. She came back.
I just think perception is really what it's all about, right? So,
But
even
did I feel obligated to put a sign up or anything like
No,
that? Why?
I don't think you have to do all that stuff, but I think the protocols are there for your safety as a business owner as well, right? Because at the end of the day, we're also can easily get sued. So you do have to have this line of what's the right thing to do to protect your members because you care, protect your business because you care, and you don't want to get sued. So really, I mean, you want to talk about perception and what are you doing? We're the only industry that I know of that actually has someone like Kevin Godfrey that we brought on to help us draw up protocols, mandate protocols, make up policy, use the correct procedures. I mean, we're talking to somebody who has 20 years in the business of doing exactly what is meant to be done. And the fitness industry, we've brought them on with the New York Fitness Coalition. So anybody who is part of our coalition is using these protocols. So that right there should give comfort to people to know that we're going above and beyond the CDC and the guidelines that they're giving out there. But I think when your industries are hard hit, like ours, you have no choice.
Yeah.
You might not want to do it, or you might get your back up and feel like, I don't have to. It's against my constitutional right. We can have that argument too, but it's all nonsense.
Yeah.
It doesn't mean anything to the people that are coming in,
Yeah.
right? Because that's who we're trying to get. I
Absolutely.
don't care what your beliefs are as a person. I just know the public perception is out there that we're dirty and we're this and we're that, and that is directly because of Governor Andrew Cuomo.
Well,
I'm gonna go over one point before you go.
Yeah.
Sorry. Personally, I actually have something that just happened to me last week, so this is new. I had a woman. She didn't feel good. She told her we canceled all our sessions. She stayed home, waited for her COVID results. They came back negative. She ended up just having rhinovirus cold. But public perception is what you guys are talking about. She perceived in her head now, I'm no longer going back to gyms.
Okay.
Yeah.
Because she realized, oh, I can still get sick from going out, and maybe I should start practicing social distancing more, regardless of where she got it from. She has cold you can get from someone just being next to you, we all know. So I think the public perception is, if I've never been sick, it's, all right, yeah, I'm going to go out, I'm going to spend money. But I have this fear, and I want to talk to each of you individually about this, is when people start getting the cold, when people start getting the flu, because we're coming upon winter months, even though it's not COVID, is this going to play a factor in people coming back to your business because they realize they can still get sick? Who wants to start with this one?
I say yes. Yes.
100%. And how are businesses supposed to survive through the next 5-6 months that we have winter coming around?
I think we have to change everyone's perception. The problem is that this landed in an election year, right? I don't want to politicize this, but it landed in an election year. So that means our media, who takes political sides, is going to inflate the narrative in the direction of the candidate they want to support. And unfortunately, for this pandemic, you know, for Trump, and I'm not going to commit publicly in any direction, but like the thing is, you know, with
Kanye
Trump.
West.
Yeah, you know, Trump
Only for VP though, in California.
Yeah, but Trump, as far as the media's perception, landed on the opposite side of COVID. So therefore, over the past 7, 8, what are we at, month 8 now? Month 9 or something like this?
I have no idea.
It's enough time where it's literally changed the mindset of everyone. If this lasted for a month, it would have been different. But now the media, for some reason, is the Bible. I don't know why, but the media to a lot of people is like canon law, and if they say it, it must be true, and people react accordingly. And you know, I hate to try to, you know, take this position because, listen, I actually have an autoimmune disease, right? So I'm one of these people that they're saying that is more vulnerable to this stuff. So I want to be clear about my position about COVID. I think it's real. I think it did kill a lot of people. I think people got sick, right? So I want to be clear about this. However, with that said, you know, I don't think that the numbers are actually accurate. You know, they talk about mortality rate, and then that's what people are most fearful about. But in reality, I think a lot more people actually had it. So if you calculate the number of people who actually had it to the people who died, that mortality rate is significantly lower, and it's not as.
Do you know what it's at now?
I don't even know what it's at now.
1.4.
Right. I actually think it's even lower than that.
Yeah.
Simply because I think a lot more people have it. Now, I put out in preparation for this, I polled my audience. Everyone likes to do that, right? We poll our audience these days, and we
Were you
do
supposed
that.
to prep for this?
But
I knew I was supposed to.
Right, but I asked people, and it's amazing how it's about 50-50 that people are either they're fine with it, I don't mind going out, mask or no mask, and then other people are like, forget it. There's no middle ground. And that, I think, has been created not because we know someone that died. Like, I know several people that actually died from it. That's not impacting my decision, though. And I think for most people, it's actually not. What is impacting their decision is this media attention that we're getting from this. I think our governor, every single day we watched our governor sit at the podium and deliver these fearful statements, and everyone panicked. And and we had a lot of other people maybe trying to what was the phrase, present in a state of calm. What was that? Whatever it is, whatever he likes to call it. But I think that these daily sort of monologues that we're getting, that this many people died, we need to make sure we live in a bubble. I think that went on for such a long time. I think everyone is terrified, and not based on facts. It's not based on facts.
It's not based on facts. I mean, because you keep on bringing up science and all that type of stuff. But it's just the overall perception. So you just go back to our industry or people who are going to go out and they're going to go to restaurants and that type of stuff. Those people are still going to come. The problem is that that's not enough. So if we don't start moving forward and we're not going to be allowed to bring new people in and we're going to still listen to the WHO, the CDC, Dr. Fauci, we're going to get up there with Governor Cuomo, Mayor de Blasio, and we're going to listen nonstop with what's coming out. Everybody contradicts everybody now, right? So the WHO just came out and said that lockdowns aren't beneficial. The CDC changes their wording every other week, right? So I just think it's the perception of what you want to do with inside your industry to the public. And again, I can't stress it enough. That's the main reason why Kevin is here and he's part of helping us in this industry, because we realize it is nearly an impossible task to do, because I can tell people what we're doing all day long. If they're still going to be fearful, right? And then on the news, you're going to be told, well, I can still work out outside. I got a home gym equipment, or I still order my food. I don't need to go out. We're never going to continue to go forward. And if you think it's okay that you're going to grow up with your kids not interacting with people, if you think it's okay that you're not going to have any, community or anything like that, well, then maybe you should stay home. But, at some point in time, we do have to make those decisions.
So, Kevin, I want to throw this to you.
All
I want
right.
to talk about something I kind of prefaced pre-show.
All right. Well, actually, I'm gonna stop you first.
Go for it.
Actually, I'm gonna circle back to your first question about that woman,
Go
because
for
it's
it.
actually pretty. It's gonna be important to answer both of what you both just said. So, with what you experienced with the woman that called that said she was, experiencing COVID-like symptoms. All right. So a lot of the documentation says COVID or COVID-like symptoms. COVID-like symptoms is obviously defined as coughing, right? So it's completely generic. So as we get closer into flu season, winter, etc., more and more people are going to be calling everyone in this room and saying, hey, I can't come in today. I have a cold. I'm going to go get tested for COVID.
Yeah.
Now, what technically that triggers, you as well, Department of Health triggers as well, is the suspected COVID clause in the guidelines. Now, what that means is that you now have to shut down all of the equipment that she used, the locker rooms, the front kiosk, anything for a period of 24 hours or enough time to properly disinfect or whatever else.
Is that
now,
with a confirmed case or just suspicion?
confirmed or suspected? Wow. And that's New York State guidelines for you and you and you. Now, let's say you have, well, you're different because you're a one-on-one, really. But let's say you have a class of 5 people and or 10 people, and over a course of a week, a bunch of people just get colds. And those people call you once a day. Now, once a day, you are now going to have to shut down your gym and deep clean. You're going to have to do the same. Now you are spending more time and money and energy cleaning cold for a general cold because of the outdated guidelines and policies that are put in place arbitrarily and not backed on science, because they were not implemented based on seasonality. They were just, it was just COVID-like. Suspected. It makes no rhyme or reason. So that's actually something that hasn't been addressed yet in New York State, and no one's really actually ready for it. But we're just starting to see
unprecedented experience. So they're
But-
trying to figure this out as they go along.
Well, in terms of the businesses that actually haven't really read the guidelines, aren't really aware of it, that in the next several weeks that they're going to be shutting down hourly doing deep cleaning, because every time someone calls and say, hey, I don't feel good, I have a scratchy throat, they have to enact those protocols in order to be compliant. And if that person calls them and also calls the Department of Health and they find out that they didn't do those guidelines, they're shut down.
Wow.
Thank God I clean after every client. It doesn't matter.
Well, you have to do different cleaning. But that's what I'm saying.
Wow.
You have to enact the suspected COVID cleaning.
Wow.
So it's different now, right? So, all right, so go ahead. Sorry.
I want to talk about, because everyone keeps talking about what you do. I don't think a lot of people know what you do and what you're testing for.
I haven't.
Yeah,
I
let's
figured
talk about
that
that
out
first.
I'm still trying to figure that out.
Fair enough. So what do you do? What do you do? How are you getting involved in gyms, et cetera?
So basically, through Trusted Safe, we essentially test for adenosine triphosphate, which is an organic biofilm on all surfaces produced by organic material, right? So we all have ATP on our hands everywhere. I touch it. We place ATP on surfaces. Now, ATP is the food source for bacteria and germs. It is the respiration and replication source for viruses such as COVID. So an increased amount of ATP on surfaces is a higher likelihood for bacteria, germs, and viruses, and that's per the CDC, and it's all backed up, per science and whatnot. So what we do is we come in and test for increased levels of ATP. And we use the same testing equipment, swabs, et cetera, that the CDC uses in restaurants, so when the Department of Health comes in and they do swab tests and everything like that, that's what we use. So it's really an apples to apples. And we got involved with first Suffolk County, because we were asked to come in and write some protocols for schools and daycare centers. That's the royal we. It's actually just me. So it's daycares and schools and restaurants and various other industries and government buildings and whatnot. And as we were progressing through the different phases, it sort of, I started to notice that the fitness industry was kept getting bumped and was not really involved in anything. And part of what we were offering, again, Royal, was through Suffolk County was a donated service, a lot of testing and whatnot. And eventually when it came out that the fitness industry was essentially just getting shafted, we just pushed everything into the fitness industry. And at this point, it's been, 3 months?
About 3 months now.
Yeah, about 3 months now. And since that point, Charlie and I have worked daily, pretty much daily on this, working with the senators and commissioners and various counties, just trying to figure out exactly, essentially try to form a unified, coalition, not necessarily just based on the owners, but through the various governments, because it's just a very fractured overall industry. And that's, I think, one of the obvious issues in just getting the protocols pushed out that need to be pushed out to protect the industry. Because I don't know what numbers, but what is it, 80 to 100,000 people in New York State, rely on this industry for income in one way or another.
Wow.
I mean, that's a huge number.
I'm going to throw something actually specific to that, talking about the fitness industry.
Sure.
As of this year, they're at 429,000 deaths from cardiovascular disease. Still the number one leading cause of death in America. And those numbers, on average, cardiovascular disease kills about 655,000 a year. They're expecting those numbers to go up. This has been a big thing. They've been showing more and more that obesity is the biggest underlying condition as far as COVID deaths go. And we are shutting down basically the health industry on top of it. So these numbers will probably skyrocket, always staying and outpacing COVID. So personally, if we take this into consideration, is this something that we should be concerned about? Should we be concerned about that 600,000 people are dying from cardiovascular disease and try to fix that? Or should our focus still be put on COVID? I know it's kind of A or B odd question, but Charlie, you want to start with that? Then I'm going to go with Eric for it.
I think the COVID part of it, it's not the numbers, it's how quick it affected everybody and how fast we had that death rate, right? So I don't think we can compare, the long haul to this, because this was just an isolated thing that we lost all those people in such a short window of time. So had we not done anything, would that number have been in the millions inside of 3 or 4 months? So I think they are different and separate.
Yeah.
Where I do tend to agree is that the one industry over these last 6 and 7 months that could have done something, could have helped, was mandated to be shut. And I'm not too sure the rationale behind it. Wouldn't it have been a different narrative if the governor had gone on and said, listen, we have to close everybody down, and we're sorry we have to do that, and we understand the effect this is going to have on businesses. But what everybody should do is get in touch with their health professionals, their fitness professionals, have them program for you at home, have them give you equipment. Maybe they can help you doing. Wouldn't it have been different instead of getting on there saying that gyms are problematic, gyms are dirty, that we're not a service.
Immediately vilified it.
Right.
Yeah.
We're not a
Ridiculous.
service. We're not essential. Instead, what you did was you put into phase 1 on your own accord tobacco stores, fast food,
Liquor.
Thank God they did. Liquor.
CBD, right? I mean, everything but gyms.
But gyms. So the very thing you're talking about that causes all of these things were allowed to be opened. And then you vilified the very industry that could have. So I do think now, you're starting to see the science come out, and they're talking about obesity. They're talking about all these things, right? Because those are still trigger words in the society that we live in. You know, if you post anything, or at least you should know, you have to be very careful on the word that you use.
Of course.
Because if you use the words obesity, let me tell you something. The emails you're going to get back are incredible, full of hatred and everything else, when you're really just trying to help. So I agree with you. I think it is a bigger problem now, and I think that our industry is even more important now, because people need to wake up and realize that if you are healthier, if you were fit, if you were eating right, if your nutrition was on point, the chances of you dying from this disease were almost minuscule.
Yeah.
So maybe part of the reason why we had such a high death rate is because of the overall health of the country.
You want a stat just to kind of overlay what you're saying. 0.7% of people that die from COVID have no underlying conditions. 0.7.
Less than 1%.
Less than 1% we're looking at right now. 75% are with, and obviously the mixing numbers, they're not really sure. There's a lot of up and down whether or not they got it before or after. On top of that, we're looking at 73.6% of people that died ages 65 and older. So it's not really targeting the younger generation. But I want to prompt the same question to you. In essence, what's worse? What do you think should have been done? I know Sobel's kind of in that health conscious industry. So talk to a little about.
Yeah, so I was actually very shocked that like a lot of the fast food restaurants and everything really did take off. I mean, people kind of took this as a whole vacation.
I'm going to tell you one thing. Taco Bell, I've never seen longer lines in my life.
There's a Taco Bell across the street from my house. And yeah, you're right. Until 2 a.m, that place was packed. And I'd say probably later at night, it was probably mostly like the high school kids and college kids, because a lot of them were home. But yeah, McDonald's line down Walter Avenue, I was shocked. I've never seen that before. And, you know, it's a shame. I mean, don't get me wrong. I was home, I was eating, but I wasn't eating the bad stuff. Mainly because I didn't want to wait on the lines, but...
Right.
You know.
Exactly.
But, you know, I kind of took advantage of it and, you know, learned how to cook a little bit better. I got 4 kids at home, so we had to make some big meals. And it was kind of fun. I mean, I wouldn't say it was fun, but it was different. I never had time like that off. What were we going back to the question again? I'm sorry. I got kind of like lost.
Was it
with
right
the
for
healthy
them?
food? Yeah.
Yes.
So all right. So yeah, the majority of what we sell is fresh and healthy. It's all fruits and granola, and we have smoothies. I mean, everything's fresh or frozen fruit. We don't put any sugars or any additives in there, so it is good.
No plugs, you.
No, I'm not trying to, but you know, like mainly the customers that come to my store.
TrustedSafe.org. TrustedSafe.org.
We're open until 8 p.m. But you know, mainly the clientele that we have, you know, they're looking out for themselves. You know, it is a delicious product, but they're also
I
you know,
go
they're
twice a
health
week.
Yeah, so you know.
He paid you. How much?
A lot of money.
How much to say that?
You know, but even if they take, you know, an acai bowl for lunch instead of, you know, their bagel or their Taco Bell or something like that, you know, it is a change for them. And, you know, it's high in antioxidants, you know, it boosts your immunity. So it is good. We should all be really watching what we eat, at least if we change
Shocking to you, though, watching, especially gyms, be vilified. And
it didn't make any sense. To me, you know, I have a membership at a gym. Do I go? No, I'm not like everybody else, you know. Sorry.
Actually, you are like everyone else.
Well, except everyone else in this room. Yeah. You know, I do want to go, but, you know, time sometimes is tough with me, soccer practice and everything else that goes on in my life. But, you know, we got the gyms, yeah, like you said, man, they shouldn't have been shut down. They should have been restructured. Mm-hmm. You know what? That would have been great if, you know, I'm sorry to admit about it. I Planet Fitness.
I don't care.
Okay. But I know it's like kind of.
Honestly, I don't care. Fitness is fitness.
You know, and I pretty much just go there for the treadmill, and that's all I want to do.
Yeah.
But you know, like I know that they reached out and they were trying to do something online, and you know, you could like sign up with them. I didn't, unfortunately, but I did step up and I walked around my yard, and you know, we took walks around the neighborhood and stuff like that. It wasn't a great workout, but it was just something to keep the blood moving. You know, I think. You know, a lot of businesses, they had to kind of look at their bottom lines and kind of restructure it. And, I mean, I don't know anything about the gym business, but like you said, so for someone to reach out and and talk to their fitness trainer and be like, hey, what can we do? Sending equipment. I thought that was a great idea too. Just kind of some kind of guideline, like Monday, do this from 10 to 11. I think a lot of people need that fitness structure in their life. Having a gym membership, it's great. You go whenever you want. Planet Fitness is open. I don't know when, but it doesn't make you go though. I feel like if you have that time where I got to be there at 9 till 10, I think that's better for most people. I think that'll work for me. That's probably what
community is what makes you go to anything.
He's right down the road from you, man.
Are you really? Where are you?
Look, I plugged in another one.
Don't do it, Charlie. Don't give him your address. Don't do it.
But community is what it all comes down to. Yeah. You can do anything from home. You can be taught from school from home. You can order all your groceries from home. You can do religion from home. You can read your Bible. You could do everything from home. What's the one thing that they all miss? It's community. It's interaction with people. Our children aren't interacting with people. My daughter's not going to have a graduation. My daughter's not going to know what prom is, right? Those are rites of passage that influence and make up who you are. So society overall is taking a tremendous hit. And we're not interacting with each other. Instead, we're becoming enraged animals. The way we interact with each other on levels now. So community is why people go to the gym, and that's why they stay. They stay because they're around like-minded people that want to be fit and have that same sort of thing, and you push through that workout. So that's a big part of it.
Let's talk about. I want to talk about community. I'll bring the question to you. Community has a lot to do with mental health, and we all know this. We need it as humans to be around other people. It's just good for our overall well-being and who we are as society. Studies have shown that anxiety from quarter 2 to quarter 3 is up 3 times reported average normal. Depression is up 4 times, and suicide has doubled. Is this related? I know the answer is yes. I know the answer that we're leaning towards is, well, that's why people are shopping more at fast food. They have no mental health. Where do you go? A lot of people turn to food and comfort food to eat and kind of get over this norm. But as someone who has kids and seeing these numbers, you got triplets. So how is this affecting them? Are you seeing it with kids? Are you seeing this with business owners? Are you watching people's mental health decline? And does it make you regret that the closures are happening on the school or on the business level? Do you feel like businesses and everything should be open for that sense of community? Because you can't get the community that you get virtually as you do in person. It's impossible.
Yeah.
So talk to us a little bit about that.
Well, you literally you were like telepathic. This is what I was thinking when
I read your mind.
You did. I absolutely think that there is an impact mentally. I mean, we're talking here from the fitness perspective. What are the physical benefits? But there are also mental benefits for people exercising, moving, being with you guys. You're saying community. I think we're created to be companion individuals. And the second that we're forced into this secluded state where we have to be alone is when we're going to risk all those mental disorders. Depression's going to go up. Kids and adults. Those are going to be 2 different conversations, right?
Yep.
But I'm going to add something else. You brought up suicide rates and depression. Divorces are up. So people are getting divorced more than ever before. So this has really affected people's game mentally. And I think I don't know why they decided to pick on you guys, the fitness industry, and for you guys to be the pawn that they use to try to alter these numbers. But I think you were saying this before, I think it's also one of the most important industries for our community. If we destroy our marketplace, and we'll start with you guys, they're destroying you guys, right? It destroys our marketplace. Who brought up how many jobs it represents? I think you did.
Yep.
That's almost, 500,000 in New York?
Well, 80,000 to 100,000 in New York State.
That's significant, right? So you destroy local marketplace, it's going to destroy community. Right? You're not going to have your sense of community that way. So, and that affects your game mentally. So yeah, it affects everything. My kids not being able to be in school in the same way, having to always, function with a mask. We don't know the long-term effects of that right now. So we're going to have to wait in the next few years to see that. I don't have a crystal ball, but you know what? I'm smart enough to know that if I do something to my kid, what's going to happen. If I punish my kid and I say, you're not allowed to do something forever, you're not allowed to see your friends for whatever reason if they're sick, I can see that in my kids. I can see what happens, when they start getting upset, they can't, hang out with their friends. And this has just been a couple months. let's stretch this out now over the course of a year or so. I think this is going to affect children long term. And I think that, now you're going to have, school psychologists are going to have to be brought in. And I know it sounds dramatic, and I'm not trying to be dramatic, because I think it's important for us to just recognize truth here. And it's going to impact children. I think they need to be focused on, and something a plan has to be put in place for them. We're just talking about business right now, but children need it as well. Adults, people who struggled with their weight, without the accountability of someone like you guys, they lack the discipline. So in that world, they need you guys, and the world removed that from them. So that was disservice now to that group of people. And it's a shame. So I think that as a community, we want to get back. We need to help our marketplace, and a good starting point is the fitness industry. No offense to you, but like the restaurants actually, at least you guys had the ability to somewhat stay open.
Yes.
And it's terrible that the fast food industry took off, and I'm not considering Soul Bowl fast food at all, but it's a shame that, out of convenience, people are like, oh, the only thing that's open is McDonald's, when that's not true. There were a lot of other options, and, people don't know how to, I don't know why, they don't know how to cook. You ever noticed that? Like, people can't cook, can't change a light bulb, if
Lots of things
God
we
forbid
can't
if
do.
electricity ever failed, like, good luck everyone making a fire, but I think we need to get back to that and really focus on you guys. And I actually think you're not the primary problem. I think you're the primary solution moving forward. And, it's just a shame. I'm looking forward to the election being over. I think that's going to free up a lot of these. I think magically, by the way, a lot of things are going to magically just heal itself once the election is over.
It might. We'll see. I mean, but it was also the churches, and it was the movie industry too, because anything that we do for recreation, right? So fitness, it goes into sport. So our kids can't play sports. Our kids, it was canceled in Nassau County, Suffolk County. So, what about the kids who were going for scholarships? What about their last year in high school? What about the college kids who are looking for the pros? But there's exercise just isn't going to the gym. Exercise is everything. It's sport in general. It's movement, right? It is. It's basic movement. That's taken away. But then your sense of community for churches. So whatever your belief is, whether you're religious or not, for a lot of people, that's a sense of community and going to, and it's a relief of anxiety or just feeling more comfortable, right? Movies, the industry, it's a time where you can turn off for 2 hours and think about nothing but what's on that screen. You go with your family, you go with your friends, it's entertainment. You took that away.
You can disconnect.
So you basically took everything away that does that, exactly what you're talking about, and has that sense of community. So for me personally, I am a believer that the American people and the public will decide the fate of businesses, and that the government now needs to get out of our way. I think they've overstepped, and I don't think they know how to put the toothpaste back in the tube. And I think it's going to come down to the American people making them do it.
Kevin, you're the scientist on this. And you're giving me that look.
All right. Way to transition into that one. Okay.
Watch yourself now.
Yeah, seriously.
But I have to add, by the way, I'm actually a published scientist. I'm just putting it out there. When I was in college, I was in my biomedical research class, and I just happened to be part of the group that was published. So by default, I got included. But
So I'm gonna jump in. I had the same thing. I was a published scientist too.
Is that right?
No, for real.
Oh wow.
We did one. My brother and I. We took weight loss and looked at every single study. And he did it for his project, and I helped him. We put it together and showed the best way for someone to lose weight based on science.
Wow.
It was pretty interesting.
All right,
What
I'm
was the
impressed.
result?
HIIT training.
Surrounded by a bunch of nerds.
I know.
All right.
That's offensive.
All right, Kevin.
What do you got?
All right, we got some moral questions for you.
All right.
Can you mix morality and science? Is that possible?
That's what we're gonna go for.
Oh, all right.
That's what we're shooting for. That's why I'm asking him. It's harder for
luck.
him than anybody else. Everyone,
Turn off the mics and camera then, and I'll answer you.
Right.
every time you watch the news, every time you hear anybody talking, it's the scientists say this. Mm-hmm. And we all know that's true. I don't care what you're watching, who you're talking to. They come on based on science, this, and this, and this. Mm-hmm. I don't believe this is a science question. Mm-hmm. There is always a cost to destroying people's lives. There's always a set norm. For a great example is if you cared about every single human life, you wouldn't drive your vehicle because thousands of people die in car accidents every year. So we constantly take these calculated risks and go out because there is a cost to certain things, right?
Yep.
So we're going to talk about the cost of you personally believe as a scientist, follow the science.
This is like a huge build-up here.
Yeah,
All right.
follow
All
the
right.
science, keep things closed, or are we taking it more from, have we reached that level where it's already passed? Where, science does say this, we should just all stay closed, shut down, it will go away in 3 months.
Okay.
But have we passed that tipping point where we do need to open?
All right. So science, just like any other thing, is an industry. All right, because you can find scientists to agree with whatever you want a scientist to agree with. All right, so that's why on commercials there are 4 out of 5 doctors recommend X. Right, you get focus groups of doctors. The way that actually works, if you don't know. So right, you get 5 doctors in a room, and you say, "Do you like this toothpaste?" Or dentist rather. All right, you say, "Do you like this toothpaste?" 3 out of 5 say yes. Next, you get 5 more. 2 out of 5 say yes. Next, you get 4 out of 5. 4 out of 5 dentists say yes. That's how that works. All right. So you just keep getting those scientists to agree with you. Nope, he doesn't say we should open. Nope, he doesn't say yes, he says we should open. That's the scientist I want. Or inverse in the case of Cuomo, right? So nope, he says we should open. No, we don't want him. He says no. He says we should stay closed. Get him on the news. Get him on my press release. That's how science works, just like any other thing, right? So it's skewed. It's skewed to politics, but without politicizing, right? So we are at the tipping point. Not necessarily morality based. We're at the tipping point economically based, right? I mean, we just can't survive. New York State is bankrupt. Individuals are bankrupt. They're going bankrupt. So we need to start the process to open, and that's what this is. So, in terms of the fitness industry, the protocols, right? Let's just I'll focus on that. So there are additional and new studies coming out every day, right? There was like a study 2 days ago about gators, all right? The little face things, right? They were saying, well, the first study that said that gators weren't effective was flawed. They are actually more effective than cloth masks, right? But then the guidelines say that cloth masks can be used, but asterisk, the CDC doesn't recommend it. So you just look at it and you're like, wait, there's like 11 different things that contradict itself on that one paragraph, all right? But where is the revised guideline? There is no task force. There is no updated team. There's no team updating that in real time. So where is the ongoing forward momentum that we need to start the process to open, right? To either reduce masks or increase 33% to 50%. It's stagnant. So it's not necessarily, do we just like flip a switch? That's never going to happen. But where's the team to start flipping the switch, right? Or to go to Home Depot and buy the switch, right? Just do something, but no one is doing anything, and that's the actual inherent problem of the whole process.
It's a tough question, like I said. Yeah,
And
great
that
job.
was the political answer to the question, by the way.
Yeah.
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 Nailed that one.
That was a politician answer.
Yeah.
I'm going to put you guys on the spot if it's okay, because it's sort of on topic.
Yeah.
I don't know if you guys mind being transparent about this, but
Always.
what are your margins as a gym business owner?
We basically operate on a 25%. So at 100%, we're working on 25% profit.
Right.
So at 33%, we're getting crushed.
Yeah, well, that's why I bring it up.
We're
Like,
gonna
it's just like math never lies. I love
gonna
math
crush
for that reason.
0.
1 + 1 will always equal 2. It'll never equal 3. So if you're operating at 25% margin and even at 100% capacity, it stands to reason that 33% capacity, you're losing money.
Now add in the extra expenses. We're a
Right.
company.
Exactly. So, and then now, let's say if I'm a product based, and I own some type of product that I'm selling, if somewhere along the manufacturing line, so a supply, that price gets increased, what happens to the end user's price? Does that not also go
Absolutely.
up? Right.
I raised my prices.
Right. You have to.
I had no choice.
So I think maybe the first couple months, that conversation, we didn't have to have it. But I think everyone, politicians included, has to start having this conversation that every single business is going to raise their price. Period. End of story. They're not going to be able to make, you're talking about landlord, things like rent, and then everything else. You're not going to be able to pay your employees.
Nope.
Right? So what's the alternative here? I mean, I think that like America, stop listening to the news and just do math. Business owner A has to make X amount of dollars to turn a profit, right? If he can't reach that business, is going to go under, right? I mean, who's going to give you money forever for free to operate a business?
No one. The whole.
No one is.
We're
And this-
built on a house of cards right now.
Absolutely. And that grant, I'm sorry, is not free money. It's and I know
taxpayer money.
It's taxpayer money, number one, and they're saying it's a 100% forgivable. For anyone who's trying to make the argument that it is, you clearly don't own a business because that's BS. It's not 100% forgivable. It was 100% maybe if you applied, you got the money, but then there's a whole bunch of loopholes that you have to do in order to qualify, and you're not even going to qualify for 100% of having that loan forgived. You know, it's ridiculous.
For the first time in our history, the deficit is higher than the wealth of the country. That is alarming. And that's not even including the $2.4 trillion bill that's still sitting in the Senate right now. And that's not including the bills that are going to come after. That's an alarming fact.
Let me talk about something with this. I think it's really important. I personally, people my age, they don't understand that the government doesn't own money. They have no idea. Well, the government can just give away free money and
print more of it.
Just print more of it. That's actually the mindset a lot of people my age have. They say, why can't they pass a $2.4 trillion bill? It's easy. Just do it. They don't understand that in the long run, that's going to come for us.
Sure.
The stimulus checks we get pushed out, that comes from us. Do you know that you still have to put that in your taxes?
Yep.
So you're going to have to pay tax into that. It wasn't $1,200 for free. You're paying tax on top of that because you got revenue, and then you're going to have to pay for it over the course in the long run because now you got to pay for every single person. So what's going to happen to taxes?
Well, inflation's going to go way through the roof eventually.
Oh my gosh, wheelbarrows of money for a loaf of bread. We've seen those images.
Yeah.
I don't know why we don't look at history. It's happened before.
We're trying to erase history, but that's another.
Yeah.
That's
So,
another
I
whole
mean,
argument.
Episode 4 of the.
For me, it comes down to the economics now. I get COVID, I'm a believer in it. My wife dealt in those units. I get it, but economics matter. Everybody else matters, and if you're not going to take it into consideration, we're just going to get crushed.
Yeah.
We're just going to get crushed. So what's supposed to happen? That's my thing. So what is somebody on the opposite side? What's your end goal? Is it a vaccine? Because when the vaccine comes, are you lining up to get it? Because I can tell you right now, I'm not.
I'm not.
I'm not going
Okay.
to
So
No
Let's
way.
pull
No
this
way.
room. Who's getting it? Raise their hands.
No.
Okay,
Not
there
even
you
close.
go.
So
My
and
kids aren't getting it.
That's
I'm
what
not
I'm going to say
getting
too.
it.
I'm not.
Nope.
Kids
I
aren't
agree with
getting it.
you.
I'm not doing it. Like, I mean, I'm an older man. I'm not having children or anything like that anymore. But I'm not giving it to my kids. My daughter's not going to get it. So, is that the answer that we're all waiting for? This special vaccine, or really is it about our immune system? Is it really about us just being overall healthier? And if that's the case, then we need to move forward. All right, and we all have to stop being so angry, and we all have to stop all of these things. But if the economy crushes the way that it's projected to, you're not going to see these numbers until the first quarter of 2021. You're not, right? Because the market's still doing whatever. It'll come when the election. The market right now is gearing towards who they think is going to win the election, right?
Absolutely.
And that's not from us in the room. This is to the top 1% that are watching that right now. Okay?
I got to be honest. I think they're actually going to move to a cash position soon. I
They
really
might.
do.
They might.
You know, I know the stock market's doing well, but I think that you're going to see a lot of people move to a cash position.
Because they're not going to know. And then you're not going to know until afterwards even what
Yes.
happens, right? So that first quarter is going to come true because eventually these mortgages have to come true. So people who haven't been paying their mortgage, eventually you do. And if you don't, they're talking a 30 million people being evicted. 30 million
I believe
people.
that.
That is almost 10% of the entire country is going to be evicted. So what are we doing? Honestly, what are we doing? We're just going to continue down this path?
Yeah.
You can't tell me that something has to give. Like Kevin said, is the process to move forward? And that starts with our federal government too, guys. I don't give the federal government a pass here. I mean, I live in this state of New York, and I cannot stand Governor Cuomo.
Yeah.
But it starts with the federal government. The
Yeah.
federal government just released its hands and said, you guys deal with it. I don't believe that should have been the answer either, okay? And there's nothing coming forward to say this is how the states are going to need to move forward. And then you have the states that are power playing and they're jockeying not to allow certain things to happen. If you look at the two states, which is New York and California, the two Democratic-run states, those two states report a majority of the wealth for the country in taxes. Without the two of us going, the rest of the country is just going to follow. It's just going to lag behind.
Of course. You
Yeah.
see that with everything. When we look at cases spreading out, it started off in
Yeah.
New York. And then from there, the epicenter, where everyone visits Manhattan,
Yeah.
the states were just what to follow.
Yeah.
Well, with what Charlie just said, the federal government washed their hands of it. They gave it to the state level. The state level washed their hands of it, gave it to the county level. I actually was on the phone with one of the commissioners when Cuomo made the announcement that he was basically presenting the guidelines that we essentially wrote. You know, we did. And the commissioner was like, wait, what just happened? And I was like, well, you knew about this beforehand, right? Like, so, and she was like, I'm literally finding out about it in real time with you.
Wow.
And I said, wait, so like what? She goes, no, Kevin, you don't understand. In real time with you, I am finding out that I have to create a task force, a Department of Health task force to inspect 600 plus gyms or 1,000 plus gyms. What am I doing?
Yeah.
I have no idea what's happening right now, you know, and I have to go. I have to figure out how this is going to play out, you know. So like it just went down and down and down until you went to, you know, county/town level where there are no resources being provided financially, personnel wise, and they were just like, good luck.
Yeah.
How can you do that?
Right.
You can't do it.
I want to kind of start wrapping this up a little bit. I'm going to do a little. I know.
I want to do a quick question. What would happen if you guys just opened to 100%?
So,
Like, what's really holding everything back?
so there's
besides
a couple
someone
of
coming in and being like,
there's
hey,
a
you
couple of
can't.
moral questions on that, right?
Yeah.
So, as the president of the New York Fitness Coalition, we're dealing with probably about almost 80 to 90% of all fitness industry in the state.
Yeah.
If I turn around and I tell people just to do that, right, I'm essentially responsible for them coming in and arresting you, finding you, taking away your license to actually do business. Now, although that might be a small number because they can't get to everybody, I'm still the one responsible to do that, even though you made up your decision that you were going to agree with me. I will never bring that to the forefront. Now, if you want to do that as an owner, that's on you, and you can see what happened in Jersey.
Yes.
I back those.
What happened to
I
those
back
guys?
those
Now I haven't
gentlemen.
heard.
I
They
back
got
those
their-
gentlemen, but they were arrested twice.
Yes. Everything was stripped.
And
from them.
they were stripped of their license. Now they have to fight to get that back. They found a creative way to open up, and I give them, you know, an A for creativity. But they personally were willing to take that choice. They weren't, you know, requested upon the whole industry to do that. Yeah. So I think if one, you would never get it to happen, and believe me when I tell you, you would not even remotely get that to happen. And then you would have, let's say, out of 2,500 gyms, you'd probably have 50 that would do it.
Okay.
Now that's easy enough to arrest, right? That's easy enough to fine. And you're talking fines of $15,000. And then lawyer fees of $15,000. And even though that the arrest and the fine are unconstitutional, you still got to pay the lawyer to fight it. Yeah. And then they'll take your license. And now that's a 1-year minimum suspension of your license. Now you got to fight to get that. Now what are you doing? Now you're just screwed. Because of what? Because one big mouth told you we should all do this. Yeah. That's not, to me, is the right way to do, and I would never be responsible for that. But if you as an individual wanted to take that stance, you could be the hair salon person that tried to do it. You could be New Jersey who tried to do it. And if you want to let me know how that all fared out for them, well, then I say go for it.
It's going to happen, though, because if this continues, people get more and more desperate. So
It
that
will.
number of 50 is going to jump up to 100 to
and it'll be
1,000.
based on the individual.
It's their livelihood now.
And it'll be based
right?
on the individual. And I'm fine with that, but it has to be individual to do it. I don't think a group or an organization has the moral right to make those type of decisions.
Yep,
Just as
you're
I
right.
believe that the Governor Andrew Cuomo doesn't have the moral right to arbitrarily say who should be opened and closed. I think that New Yorkers and Americans should have that choice.
You're a good leader. You have my vote.
That's just
Vote for Charlie.
Well, and that's pretty much why the 33% should just be dissolved.
Yes.
Right.
Yeah.
I mean, immediately.
Yeah.
Like that should be immediately in revision. And that's what I was sort of saying before was like, you know, the guidelines are now 2 months old or a month old or however old they are. There's been no 1.2 or 1.3, but like those revisions need to come out. And the very first revision that needs to be made is that 33% has to go. We can fight forever on the masks and obviously certain things, but that 33% has to go. And then you leave it up to the people, right?
Yeah,
Because
we all know
not
what to
necessarily
do.
100% of people are going to come running through your door, obviously.
Yeah.
No. And most people, even at 33%, aren't getting 33% back in the door.
Yeah.
But just let the people choose.
I want to talk about something you just said because that's actually my final question.
Perfect.
You actually led right
Beautiful.
into it.
Beautiful.
You said it's the right of the people. So this is the biggest debate that's been going on in our country since it started. How much power should the government have? And in essence, is it? Yeah. Listen to the preface of the question. This is it's pretty split where you have people that believe there should be big government, and then you have a party that believes there should be very small government. And this is something to realize. Some people believe that the government should take responsibility, put restrictions all over the business, and force people to comply to stop. Where others believe it's the right of the individual to show up, it's the right of the business to operate, and if they want to close or not go, it is strictly up to them, not someone to tell them what to do so. Without getting political, which we're going to try to...
Oh, what's going to happen?
I know what's going to happen.
Well, you can do it in a non-political way.
We're going to try to talk
right?
about it non-politically. Are we at that point, if we passed, how long ago did we pass that point?
Yeah.
What's your take on it? We'll do a little round robin on this. So, Eric, we'll start with you. We'll just go right around with that same question.
All right. I think we could all, we're all grown-ups. I think we could all decide on what we need to do. We know how to stay safe. Just bring that back to me again, because you.
If we passed the point.
Yeah, we passed that point.
So
a long
when
time
was
ago.
this point?
It was. I would say it was June 1st.
What's your rationale behind June 1st?
Because pretty much the weather got really nice. They said the coronavirus can't survive temperatures above 80 degrees, 70 degrees. People were just they were done. We were all told, to hunker down and just hang out for a month, and that was about 2 months, June 1st, from April 1st, and I think we all kind of went on with our lives, opened up. I mean,
but
so many
what
people,
if there's a spike coming in the winter, which is inevitable at this point? So should they re-close everything, or should
Absolutely
it still be
not.
right to the consumer and business to stay open?
We all know what to do. We all know to wash our hands, use gloves, put the mask on if we're in public. Someone doesn't feel comfortable, don't go out. And that's it. We all know the rules now. I think it should be up to us now to decide. There's no reason for the government to be involved and lock us down. For what?
Thank you. Appreciate that. Rob, you're up next.
I would say this is probably one of the few libertarian views that I have. I actually believe in less big government, especially going through this. I think, putting it in the hands of the American people, I think every political side uses that phrase. But I think if we're going to say that, generally speaking, that people will govern themselves, then I think that should be allowed to a certain extent. Allow local government to do their thing, when needed. But I think ultimately, if someone wants to open a business, this is an American principle. If you want to open up a business, it's the American's right to choose whether or not to go to that business. And I think in the case of a pandemic, we handled it. I think as well as we could have on the front end. I don't know if I'm alone in this room. I think on the front end of even shutting everything down was probably the right decision. And I think now that we've got a more handle on the science, we've been throwing that word around a lot too, right? But the data, we have more data than anything than we've had before. I think we're in a healthier state to make better decisions. So I think less government is in this case is better. I think all of this government involvement is hurting so many people. And for me, I'm not thinking on an emotional end of it. Like, forget the emotion at this point. That doesn't matter. I'm talking about the livelihood of our communities. I think that you're going to see towns crumble. People don't realize that the health of a community is not the people that live in the houses. It's the health of the businesses in that community. If you remove those businesses, all of a sudden that community becomes dilapidated, because who's supporting then the economy of that community? So I say you have to open up. I think I'm okay with guidelines, actually. I'm okay with guidelines. Give us guidelines. But I think allow people to make their own decisions and whether or not they want to. I'll bring it back again. Like I polled my audience. Half people said I'm not going to a business and half said I am. Let them make that decision then. If people are uncomfortable with it, I will always respect that person's right to say I'm uncomfortable. I will even myself, if I'm around you, I will act in a certain way, and I will wear a mask, or if you want me to wear gloves and I care about you as a human, I'll do that. Right? But I think ultimately that's what we need. I don't want a tyrannical government. And I'll say this, I don't want a socialist government. I'll be the first one to say it in this room. I don't think that benefits our communities. I don't think it benefits our small businesses. I don't think it benefits our workforce. I think I might get shot for saying that, but it's not going to work for this country. You know what? And I'll be more PC about it. It might work for others, right? But it's not going to work for America. It doesn't. This environment is not made for that. We're not going to breed a healthier socialist, government. We need capitalism. And I'm sorry, that's the bad C word, right? That we're not allowed to throw around. But I'll throw it. Capitalism is great. Capitalism creates jobs. Capitalism enables me to put food on the table. That I made that decision. I made that money. Governments. Over government use, over government involvement, that I don't know, that just doesn't work for me, and it terrifies me.
Let me ask you a follow-up with that same thing, because I think we're on the same page. Everyone really knows where I'm at with this, but do you believe that the structure on small business, that they're putting all these mandates, they're putting all these restrictions, Is this the push to get rid of small business?
I don't think so. I don't. I don't. I hope not anyway. But no, I don't think it's to get rid of small business, because regardless of what political side you lean towards, is when we take the microphone away, even Democrats want small business. They understand that they fuel the economy, but they can't say that publicly. But ultimately, they know this. So I don't know if you guys are Democrat, a Republican, an independent, a conservative, a libertarian. It doesn't matter. When microphones and cameras are off, everyone believes in, guess what? Making money. Because why? They want to buy a home. They want to send their kids to college. They want to buy the car. They want to go on vacation. And in order to do all those things, guess what? You have to earn money. And it doesn't really work well under a socialist economy where you make the money and you give it out to everyone else. It doesn't work. Because then why would, even if that's the case, and I know we're getting off topic now, but even if that's the case, then why would you want a government to determine how much you get? Well, let's have another discussion. I think the government should say that I get more out of that sort of philosophy. You know, it just doesn't work. And we could keep on talking in circles and circles about this. You know, I know you brought up New York and California. The top 1%ers are in these communities. Guess what top 1%ers like to do? Earn more money. So if you say that you're going to make less money, guess where they're going to go? The place where they can at least make what they were making before. Sure. So they're going to leave New York.
You've seen it.
And guess what? Rich people, rich people are mobile. Right? That's the truth. People who economically are not in the same level because they don't have the finances to do that, they're not as mobile. So you're stuck in your community. Mm-hmm. And I'm going to use that word carefully, but like you're stuck and you have to make it work in your community. So if those rich people that you're relying on leave, your community that you're already struggling you're going to struggle more. And these rich people, you're going to hate them even more because they're just going to go somewhere else. Because that's what rich people do.
You saw it with
and I'll
Tesla.
say it. I don't care.
They left.
Right. You have a lot of these big communities are already abandoning ship, and you're seeing a lot of even these liberal tech companies. And I'm not saying liberalism is bad. I'm not taking a side, right? But you're saying we all know what tech companies are liberal. Facebook we know is a very liberal company. That's fine, right? But even them, right now, they're saying the majority of their staff they're allowed to work from home, right? They're going remote. So if you're removing all that economics from that, remember that you guys were asking me about Mr. Landlord. I just lost a massive tenant now. How am I going to fill up my 1 million square foot facility? Mm-hmm. How am I going to do that now? So this comes full circle. Guys, math doesn't lie. 1 + 1 always equals 2. And if I need X to survive, and that is taken away from me, what am I left to do? So that's why certain types of government does not work in this area. In America, it does not work. It simply won't. We've been conditioned a certain way. Our culture is a certain way. And our government and our local communities are built in such a way, it's not going to work. And I know we're way off topic now, but you've got me. Listen, I'm heated on this because I feel bad about the future. Like with my kids, I'm ready. I'll say this as well. I'm making a plan B for my family. And what if? Right? And I'm not saying like I'm the richest person in the world, but at least I'm somewhat mobile and I can at least make the decision. And I don't care if your audience hates me for this, but I'm looking out for my family first. Mm-hmm. Period. End of story. Right?
Like everyone should.
Right. So I'm coming up with a plan B. I'm patriotic, but I'm not patriotic to the place where I'm going to sacrifice the life of my kids. Right? So if this is not going to work, I'm leaving. And if I leave, any type of economy that I was creating in this community goes with me.
Yep.
And I'm setting up those things right now. God forbid. And I'm not. Do you think it's a novel idea? Am I the only one that's doing this?
No, you got me doing it.
No. I think any business owner will always have a plan. Will have a plan B or something like you'll adapt, you'll overcome.
Yep.
For me personally, I am not. I think government has its place. I think when it becomes an issue is when those decisions that you're making are feeding an agenda. And I think that's the reason we're in such turmoil right now is because that's what's happened. Mm. You can be a libertarian, a Democrat, a liberal, conservative. It doesn't matter. But when those things are agenda-based, now it becomes an issue. Mm. And that is as clear as anything right now. Everything that has happened or is transpiring to happen is to get one man out of office. And I don't care whether you like him or not, but that's what it is. It was to get President Trump out of office, right? And everything that's fed that way. And if you just want to take it on a New York State level, when Governor Andrew Cuomo wants to get up there and he wants to talk about the state being broke, and then he wants to blame that on the Fed, you have to be kidding me.
He wants to hire 6,000 people.
You have to be kidding me.
Yeah.
You don't want to mention your windmill project that cost how much. You don't want to mention your failed policies that bankrupted the state. So you could see it there just taking wind, right?
28 million, I think.
Yeah, something like that, right? 28 or 33 million
Yep.
for all that stuff. So for me personally, I do believe that government has its place. I also believe that people will speak and my business will survive based on the public. That is what I believe. So if I want to enforce mask mandate and that doesn't work and everybody's like, well, I'm not coming in and I fail, well, that's on me, isn't it? Because I didn't change to that climate. So I think that in this aspect, they have to get out of our way now. They cannot put all these mandates and these executive orders on us on an arbitrary basis. There is nothing to support it outside of your clear will just to enforce your authority. And at that point, yes, people need to stand up and people need to make their voices heard because at the end of the day, you're supposed to work for me. And what you also see is, where are the local senators, assemblymen, councilmen, legislators? Do you mean to tell me that every one of them in the state of New York and California feel good about all the businesses that left, feel good that homeless people are defecating in the middle of the street, that people who are trying to have dinner are having their tables turned over, that there's constant protests all over the place? You mean to tell me that everybody's good with that? You're okay that one of the most powerful states in the country turned into a cesspool? You're okay with that? Well, you must be, because you're silent. And why are you silent? You're silent because your agenda is your party. And when your party outweighs the public good and the public opinion, you've failed at your job. And you should be removed from your job because you no longer represent the will of the people. The people should have a say. The people should have a vote. And you know what? That's just what I think. So I think the mandates, the executive orders are long overdue. I think you should get out of our way and you should let the people decide the fate of all the businesses and give us a fighting chance to survive. You've taken our wealth. You've taken our college funds. You've taken our retirement. You've totally crippled the entire state and at this point the entire country. And for what? And for what? Because you personally said that this is what should happen, because you said that this is what matters. When you get up every day and you talk about a grandma losing, their lives, and it is tragic. It is always tragic. But something has to give here, right? So the people who are losing their lives as an effect from the lockdowns and shutdowns and from your executive orders, they matter. Okay, so at some point in time, I think that the people will have to stand up and kind of make a little bit of noise.
Before Kevin goes, I just want to kind of add to your point a little bit there. If a business does the opposite, let's say the government just says, guys, businesses do whatever you want, and I take it on myself and I say, no protocols, free for all. You know what's going to happen? The consumers will stop coming to me. So what's going to happen to me? I'm going to be forced to start implementing because I'm going to follow that public opinion.
Yeah.
We don't need the government to tell us what to do.
No one's recommending anarchy here. That's not our suggestion.
Yeah, it's just an understanding that the businesses will always comply with what the consumer wants, and the consumers are going to are way more enough educated on this.
Well, it's free market.
Right.
Free market.
Period.
Free market.
Kevin, going to that
Period.
same question, then we're going to wrap this up.
Well, so I actually have a lot of government clients, so let's
Okay.
no. So obviously Charlie and I wholly agree on this subject, which is why we work daily together for 3 months on this. But I believe obviously that there has to be government interjection, right? A very loosely based set of guidelines. Okay, what I don't agree with is arbitrary opinions masked as science, right? So like the 33%, I'm going to use my one, but it's bullshit. Okay, so it's it came out of nowhere. It's they initially it came from like drift variables of 6 to 32 feet, and it's nonsense. Okay, so if you strip all that away and you use that as a base, then it sort of goes into what you were saying. Let the owners follow the guidelines to the best of their ability. If they want to do more, they will get more members. If they want to do less, they will be shut down by the fact that no one will come and pay them for their services. That's how business works. That's how free market works, right? In terms of government, so it's not, for me, it's not big business or big government or small government. It's fast government or slow government. Be faster, be better, and just release the economy to be an economy. And that's it. That's where I'm at on this whole thing.
Well, thank you guys so much for coming on. I really appreciate it. And join us for episode 2. We're talking all about special needs. I believe that is the people left behind. We are doing that Thursday, 11 o'clock. Until next time.